So, what if the cure for chronic stress wasn't something you'd find in a pill, but maybe in a park? We're about to dive into a pretty radical idea that the beauty of our surroundings, what we see, what we hear, is actually a critical and honestly an often overlooked factor in our mental health. And the stakes here, they couldn't be higher, especially for certain communities. Just think about this. In 2018 alone, nearly 5 million Black and African Americans reported a stress-related mental illness. And that's not just a statistic, it represents a huge public health crisis. And when you look at young people, well, the trend is especially alarming. Between 2008 and 2018, suicidal thoughts and attempts among Black young adults, they nearly doubled. That's a huge red flag that we've got to start looking for solutions in new and maybe unexpected places. Now, you have to understand, this stress isn't just happening in a vacuum, right? Research shows a really direct link between these health disparities and the chronic day in, day out pressure of things like racial discrimination and poor neighborhood conditions. It's like a constant weight, and it has these profound effects on both the mind and the body. So that's really the backdrop for what we're talking about today, a true crisis of stress, and one that's deeply embedded in our environment. So, if the problem is rooted in the environment, could the solution be there too? And this forces us to ask a really fascinating question. What if the answer isn't in a clinic, but it's hiding in plain sight? You know, in our parks, in our music, and in the art all around us. And that leads us down a path toward a really unexpected solution, a whole new way of thinking that connects beauty directly to well-being and even social justice. And this is where the work of Clarence Gardener comes in. He's a researcher, an artist, and a designer, and he is tackling this public health crisis from a totally unique angle. He's really digging into how the sensory experiences of our daily lives, what we see, what we hear, what we feel, can either become sources of stress or become powerful tools for healing. And his perspective is so powerful precisely because it brings all these different fields together. I mean, you've got the rigor of a public health researcher, the creativity of an artist, and the strategic mind of a business expert. It's this unique blend that lets him see connections that others might just miss. So from this, he developed a core concept that he calls the Aesthetic Determinants of Health, or ADOH for short. The idea is actually pretty simple, but it's so profound. Things like art, nature, and design, they aren't just luxuries. They're fundamental inputs that directly impact our mental well-being. And he studies this through what he calls polyaesthetic environments. So what does that even mean? Well, think about spaces that engage our senses on multiple levels. It's not just a park, right? It's the sound of the fountains in that park and the design of its pathways. It's not just a building, but the art on its walls and the light that streams through its windows. Okay, but how do you measure the impact of something as personal, as subjective as beauty? Well, that brings us to the methodology, which is all about listening to experience. So, Gardner's research basically contrasts two very different realities. On one side, you have what he calls toxic environments. These are high-stress urban settings, often starved of nature. And on the other side, you have restorative environments, like the Atlanta Botanical Garden, a space that's been intentionally designed with art and nature specifically to foster well-being. And his approach is deeply human-centered. This is not about crunching numbers in a spreadsheet. It is all about listening. He conducted these really in-depth interviews with African American adults who had lived in both of these environmental extremes. And using a method called phenomenology, he explored their personal first-hand accounts to understand exactly how these different spaces made them feel and think and perceive the world around them. So, you see, this research isn't just academic. It leads directly to some really powerful, real-world implications for how we can actually start designing for well-being. I mean, these findings are directly actionable. They offer a brand new tool for public health, basically reframing aesthetic improvements as a kind of health intervention. Urban planners, policymakers, they can use this lens to create spaces that actively reduce stress, especially in communities that have been historically marginalized. And this ultimately just reframes the entire conversation. Access to beauty, to green spaces, to art, to well-designed environments, that's not a frill. It's a matter of public health equity. It's a form of social justice. So this fundamentally changes the relationship we see between our environment and our health, and it connects directly to the future of all of our communities. You know, Gardner puts it perfectly himself. This work is about more than just data.
It's advocacy. It's about designing a world where our spaces actually support our health and our resilience, and making sure that the lived experiences of marginalized communities are at the very center of that process. And that leaves all of us with a final and I think really important question to consider. Just look around. Your own neighborhood, your workplace, your city. What story does your environment tell about who and what is valued? And maybe more importantly, how might we all begin to rewrite that story for the better?